Good morning, everyone. I'm Dr. Tacita, and I practice at my practice, the Greater Whole, which is close to Seattle, and I'm just really happy to be here. I've worked with Viora Sinclair for many years now, and am really passionate about the company and all of the great devices that they have. Where am I pointing? Here we go. Okay. So I'm going to be talking today about elevating women's health in your practice. We're going to go over why this is an important market, key services that you want to be offering in your practice, tips for growing women's health in your practice, and then also some real cases and results. So why is this an important market? Well, it's a really huge market. So women, of course, are important, but it's also a very fast-growing market. So in 2022, it was shown to be worth about $41 billion. Research is showing that for 2023, we're at about 60, and by 2030, it's projected to be close to $62 billion. So of course, you want to be a part of that and help women. In my practice, I definitely see this emerging, I think, a lot because people are talking about women's health equality, and women are really advocating for themselves. They're seeking solutions for things that, have previously been undiscussed, or that there was just really no good standard of care to treat. So some of the key services that you want to look at offering in your practice. I'll be talking more specifically about two of these today, but of course, vaginal and labial rejuvenation. How many people have the VVR in their practice? Okay, all right, so we need to change that. Non-invasive skin lifting and tightening, we all know Sinclair does a great job with that. Sexual wellness, so this is a huge thing, not just for our intimate relationships, but also for well-being, social well-being. I had a really fascinating discussion last night with Dr. Hare, and it's such an important thing, I think, especially since the pandemic. There was so much isolation, and in many ways, while tech is growing, it seems to be taking people further apart in many ways and creating isolation that wasn't there before. So sexual wellness is actually a piece of this. It'll make a little bit more sense later. Vulvar rejuvenation is also becoming in demand. Stress urinary incontinence treatment. This is something that affects so many women. We're going to talk more in depth about this. Non-invasive fat reduction, and of course, injectables are ever popular. So I love this quote by Serena Williams. "The success of every woman should be the inspiration of another. We should raise each other up." So we're going to talk about Revive first. So we're going to be going over labial tightening and rejuvenation. So Viora Sinclair has a number of options for this. We've got the VST, which is available on all three platforms. So that's a really lovely, non-invasive, no downtime way to quickly rejuvenate, or rather tighten, the labial tissue. Then for more substantial rejuvenation, we have the VFR with fractional RF. You can also use the Dermafuse. This is fantastic for just improving hydration, laxity, and also improving pigment issues. So they're looking at the VST and the VFR. So I want to talk about a recent case in my practice. So a lovely, super active 41-year-old female presented. She's a very competitive cyclist, so on the little skinny, hard bike seats. And that creates a lot of repetitive trauma, okay? So she presented with labial hypertrophy, which she was very self-conscious about. I wish I could have shared photos of her case. But when I say hypertrophy, it was just very substantial fat pad addition to her tissue. The labia majora was very thickened, and again, it's just because of that repeated trauma. The body actually has this kind of protective mechanism where extra fat cells are created, and the tissue gets very thick. So you can imagine that also led to her having discomfort during a lot of activities in her life. She also complained of a lack of vaginal tone. So I came up with a treatment plan for her that incorporated 3 VFR, fractional RF treatments, 3 VVR to help address the lack of vaginal tone. And she had also shared too that her sex life had kind of taken a turn for the negative. And then in my practice, I do a lot of advanced hormone testing and found some imbalances, so I worked on correcting those with bioidentical hormone optimization therapy. So after her first VFR, when she came back, we were so excited. There was already a good 20% improvement. And again, this tissue, was very thick and a lot of extra fat cells, and it had already helped to tighten that up, and she was very happy. Then she had her second treatment, and in the course of reviewing hormones, we were able to touch base on how she was after that second treatment, and it was, again, improved by another 35 to 40%. So she was absolutely thrilled, and she's gonna be coming in for her 3rd appointment this next month. She's already completed all 3 of her VVR series and reported that her vaginal tone complaints, they were gone, absolutely fixed. She had more lubrication, and consequently, this was leading to a more fulfilling sex life, which of course then is improving oxytocin, which we talked about yesterday, and dopamine release. You get all of these happy chemicals and hormones released into your body when you have that experience. And so again, this is something that is not just important for sexual wellness, but I would say for your social well-being as well. So this is a good picture to kind of show you the type of results you can get with the fractional RF when treating the labial tissue. So you can see in the before, it's kind of, it looks rough. There's not a lot of symmetry. It's loose, it's lax, and by the time the 3rd treatment is over, it looks healthy. You can see there's more blood flow to the area, and it's tighter. All right, so now we're gonna go into the VVR. So symptomatic to sensational. So the VVR can help treat a number of different things, from vaginal laxity, improving your sex life, vaginal dryness, vulvovaginal atrophy, scarring, and of course, urinary incontinence. So throughout a woman's life, we go through a lot of different physical changes that can mean pregnancy for some of us, but even without pregnancy, we are constantly going through changes with our hormones. And unfortunately, that can have some very adverse effects on our health. 1 in 3 women, that's a lot, are affected by stress urinary incontinence. That can lead to leakage when you're laughing, or you're coughing, or you're sneezing, or you're exercising, or sometimes just having this urgency that hits you at inconvenient times. 50% of postmenopausal women are affected by vaginal dryness. And this may not sound like a big thing, but I have women coming into my practice every month, and the tissue is not just dry, but it actually can be sclerosed. They can have bleeding, they can have, they're more prone to infection, it hurts, it's uncomfortable. 40% of women are affected by vaginal laxity, which can lead to a lot of things, including a loss of sexual attraction. And again, many women I see kind of just write it off, and a lot of primary care physicians unfortunately tell them, well, this is just part of life and it's normal. And I'm here to say it's not. It does not have to be normal, and it should not be normal. So now you're gonna get to know more about me than you probably bargained on. So I'm gonna actually share with you my personal success story. So those are my twins, who are now 10 years old. Okay, scary photo coming. That was not actually the very end of my pregnancy. I stopped taking photos because it looked like I was carrying aliens by the end. But the point here is, you can see I'm not a huge person, and this pregnancy stretched me beyond what I thought was humanly possible. I also struggled with endometriosis from a young age. Ended up in the ER with multiple ovarian cysts bursting, 5+ surgeries for endometriosis removal. For those of you that are unfamiliar with endometriosis, it's what they think is a genetic linked condition where you have endometrial-like tissue, that's the lining of the inside of the uterus, that goes and implants itself as active tumors throughout the pelvic cavity or anywhere else in the body for that matter. And it cycles like that of the inside of the uterus, so it's not very fun. Had a uterine lift, had a C-section. Those twins caused a large shifting of my muscles, so I had a hernia repair. Eventually had my fallopian tubes removed and an ovary due to the endometriosis. So the point is that there was a lot of trauma. That is a picture after the last surgery where I had to have the fallopian tubes, endometriosis, and ovary removed. And this one really left me in just a different state. It was like sensation was gone. It damaged nerves, it damaged blood flow. And I kind of thought, well, you know what? I'm alive. I don't have cancer. I got my babies. It's okay. I'll optimize my hormones. I'll do the best I can and, move on with life, right? We don't want to go there yet. Sorry, take it back. So I was very excited. I've had the V20 platform for quite some time, and I had heard rumblings that Sinclair was developing an intravaginal device. And so when I heard that that had finally happened, I was like, please sign me up. I want to try this out. So got that added on to our platform and of course wanted to be a guinea pig. And I was thinking, okay, well, maybe this will help me a bit with the stress urinary incontinence that I was happening. Maybe it will improve my sensation a bit. Kind of any progress would be fantastic. I had no idea how meaningful and life-changing it was going to be. So after just one treatment, by week 3, the stress urinary incontinence was 50% improved. By weeks after the second one, 90% gone. Sensation, actually I'd say more than 50% improved. And that's me recently, I've recovered. I can also say that the V20's helped with just the scarring. I've done the IPL, I've done the VFR to my scars. But my point is, even for someone like me that had a lot of different types of trauma, blood, nerve damage, it was amazing. I'm a horrible patient though. I have yet to take the time to do my 3rd treatment, but I was so happy, honestly, after 3. So I am gonna do that. And I have to say too, with just patients that I have had undergoing this therapy in my treatment, it's actually been a 100% success rate in terms of stress urinary incontinence and very high rate of improvement in sexual wellness, laxity, and lubrication. Oop, so this is, I guess, a video. Take a minute just to kind of show you what it looks like. Kind of reminds me of a curling iron. But I promise it doesn't hurt at all. It's extremely comfortable. Okay, so you might be thinking, all right, so how does this little device really elicit such a great result? Which is a fantastic question. So when that RF heat is going into vaginal canal, you can see by this picture, which really doesn't do the best job of showing how close the vaginal canal is to the urethra and anus. They're actually closer. But anyway, collagen remodeling is taking place. We get thickening of that vaginal wall tissue, increased support to the urethra, and that leads to reduced urinary incontinence. What it's not really saying or showing here too is with that RF heat, we're exciting the mitochondria of the cells. probably more like in the mid to high 90s. And again, in my practice, and I've done quite a few of these, it's actually been a 100% success rate. So that's exciting to see. All right, so let's talk about some tips for growing these areas of women's health in your practice. So what I found a big thing really is education. This is something that is rarely talked about. Most people don't feel like talking about their urinary incontinence or lack of sensation in front of people. Weird. Anyway, social media can be a way to achieve this. Everybody's watching social media. Use time that you have when you're doing other procedures, you're doing your intake, to let women know that this is an option. You know, I'm sure all of you in your practice, when people are coming in, have some form of an intake questionnaire. You know, what other things are you interested in? Do you suffer from this? Put sexual wellness on there. Put stress urinary incontinence on there, and you will be surprised how many people check that box. And again, they don't know that there's even treatment for this because there is no good standard of care. In preparing for this talk, I was just, you know, kind of researching, you know, what are doctors doing for this issue. And there's the sling procedure, which is highly unsuccessful and traumatic. There's bulking agents that can be injected to the urethral canal, made of silicone and other strange substances that really don't belong there. And again, the efficacy is poor. One of the resounding things I found that was recommended for women with stress urinary incontinence was behavioral changes, guys. You need to change your behavior. And you know what it included? And again, I found this on multiple sites and it infuriated me. It included timing when you go to the bathroom. Yes, timing it. It included not jumping or running. Avoid alcohol and caffeine. I mean, come on, really? That's not a standard of care. It's not our fault. Anyway, sorry, moving on. You can share your own personal story if you have a result from this, or share mine. Share patient testimonials of what patients are saying about these treatments, how it's helping them. Host an event, educate. Education is really key in this. And I just want to point out that for all of you doing aesthetics already, you know, I would like to kind of put the term aesthetic wellness out there, because we're not just a face and a neck, you know, or a thigh or a tummy or whatever. We are all whole beings, and women have a lot going on, and they want your help, and they want to know what you can do for them, for their whole self. So I suggest trying to synergize wellness along with your aesthetic practice. If you have any further questions, I would be happy to talk, or now. Yes? Yeah.
Did you just have abdominal surgery for the tummy bag?
So yeah, that surgery showed when I had my fallopian tubes removed, an ovary, and then endometriosis lesions. So you could see kind of the belly button, and then the other scars you saw were from having fixed a hernia months prior to that. I did have to essentially have abdominoplasty for the hernia, which was another thing that ticked me off. So I didn't need a tummy tuck in the sense that I had gained a ton of weight, but I had my guts falling out. So I end up in a general surgeon's office, and they say, oh, well, you have to go see a plastic surgeon. I'm like, well, why a plastic surgeon? Well, they're the ones that fix this type of condition. Your muscles are split, all these things. So I go see the plastic surgeon, who did a fantastic job of putting me back together. And he said, you know, Tacita, if this would have been about 8 years ago, insurance would have covered this, because it becomes a life-threatening condition when you have this massive diastasis recti and your intestines are coming forward. They can become torced and you can die. But no, it's not covered anymore. It's an elective procedure, unless you end up in the ER ready to die, and then they do an emergent surgery. And I know a woman that had that happen to her. So again, this is like part of my message of trying to elevate women's health. That's baloney. I mean, that's just absolutely wrong. So I hope that answers your question. Yeah. Yeah. Yep. Yes, we did. For time management, we absolutely did them on the same day.
Were you spacing those treatments out? Was it 4 weeks?
4 to 6 weeks. And for the first 2, I believe we were right at the 4-week mark. Yeah. Yep. Anything else? Yes?
Do you use numbing creams in the VFR?
Yes. So we apply a topical numbing cream for a good half hour before, and she was very comfortable. And on the second one, I was more aggressive and followed up with her, and still she was like, no, it was totally fine. Yeah. You don't need it. So the beauty of the VVR is with the brilliant way that it's designed, there literally is absolutely zero risk of shocking or burning someone. And it has no downtime, unlike other devices. And it just kind of feels warm. Yeah, it's very comfortable. So, yes, there are a number of different settings, and I'd be happy to go over those and show you the different depths that you can be getting to. And again, the device does a great job of sensing the tissue temperature, and so you are going within, I'm past my time, so you are staying within a very specific range. Yeah, absolutely. Thank you.